Welcome everyone to Medicas Video Podcast. My name is Varun. I hope you're all doing well. We have been posting a lot of important educational health videos on our site, and I believe all of you are taking a bit of advantage by following them. And ensure that you talk to your physicians and take that care that you require in terms of administering any medications that are being discussed here, because that's very important. You should not be taking any kind of medication directly by viewing any videos that are available online. Always consult your physician, check your condition, and then follow the prescriptions that are provided by the doctors. So today we have Dr. Naik with us. Dr. Naik has been a very important person in the cancer treatment world, who is following laparoscopic and robotic procedures in terms of treating and performing surgeries for cancer patients. Dr. Naik, namaste, sir. Welcome to Medicas Video Podcast again. Thank you so much for offering
Namaste.
your time to us. Great. So Dr.
Namaste.
Naik is
Thanks for
available
having me.
in... Absolutely, sir. The pleasure is all ours. Dr. Naik is available in Fortis Hospital, Bangalore, and he also has his own clinic, which is Max Clinic in Bangalore. Those who would like to consult with him, we will give his clinic's information on our website, which is www.medicasapp.com, as well as you can download Medicas app from Play Store and App Store. We will also give information about his clinic in the video description, so you can consult his clinic directly. So the topic we want to discuss today with Dr. Naik is definitely his field, which is advancements in robotic cancer surgery. So he being one of the pioneers in terms of course, there are a lot of doctors, but he has been playing a vital role in terms of robotic as well as laparoscopic surgeries and performing a lot of complicated surgeries. We want to understand from him if there are, what are the factors that patients should consider when deciding if robotic surgery is the right option for their cancer treatment. Dr. Naik?
Right. So, see, it's between open and robotic surgery. Generally, see, robotic surgery is considered as a minimal access surgery. Laparoscopy and robotic both are minimal access surgeries. And the intention of using these two over open surgery is to reduce the pain of the patient, reduce the complication risks, the bleeding risk, and so many other advantages which are there with minimal access surgery. Now, uh, robotics is the technology which is making laparoscopic surgery easier, in simple words. So actually what's the difference between the two technologies is, in laparoscopy the instruments are straight instruments. They don't have a wrist movement. Like, human hand has wrist movement. That is our biggest advantage. We can stitch, we can rotate. So that is not there in a laparoscopic system. So in
Right.
a robotic system, they added a wrist movement
Oh,
so that
okay.
the surgeon can perform a surgery like they are used to in a open surgical environment. And they provided a 3D vision which the surgeon is used to. That is, we are all used to 3D vision. We have binocular vision. We see with both the eyes. So we have 3D. So the same 3D perception they added in the robotic technology. For the vision. So it allows the surgeon to perform a minimal access surgery when it compared to open surgery. So when you ask me, how the patient should choose between open and robotic surgery, it is all about availability of the technology for the surgeon to offer you that particular technology, and the competence of the surgeon to offer you that. These two things will really matter. So
Yes.
technology alone will not. In fact, many people assume that a robo operates. Robo does not operate.
It
In
has to
this,
be
it's a
operated by
mass.
human being. Yes.
Yeah, so this technology is called master and slave robo. There
Right,
are,
right, sir.
see, there are three types of robots generally when we consider. One is automated, semi-automated, and
Fully automated.
master
Okay,
and slave.
okay.
Fully
Master and slave.
automated,
Okay.
automated, master and slave.
Okay.
So what you see in those car factories is fully automated.
Okay. Okay.
They'll do everything by themselves. So in surgery
Okay.
also, for certain things, not in our this thing, like for example in neurosurgical robots, there is fully automated robots available. There are some orthopedic robots which today, like the I can name a brand like Mako. They're all semi-automated robots, and
Okay.
all the soft tissue robots which are used in general surgery or oncosurgery are all master and slave robots.
Okay, okay. So I
Okay,
think, can
they don't
I
do anything. Yeah,
probably, yeah, got it, sir. Because this is a big concern which patients usually have. So I go to the patient room, sorry, operating theater. The doctor will not do anything. He is just going to sit. Some robo is going to do something to me. If that robo doesn't understand what it is doing, I'm dead on the table. So you're bursting that myth by saying that the robos, especially in the treatment or surgery, are not fully automated. That will be manually has to be operated by the doctor who is sitting behind it. The doctor gives
correct.
instructions, and that will follow like a slave to ensure that it does what it needs to be done. So that's the
It's
myth that you're bursting,
it,
Dr. Naik.
it is not even instruction.
Okay,
It only
the
mimics the
command.
hand movement of the surgeon, no command. See,
Okay,
you are technically speaking, it is a command only,
yes,
but
sir.
what surgeon robot does is mimics the hand movement of the surgeon. So
Right, sir.
if I move my hand in particular way, that robo will mimic that hand movement. So literally, it is it is doing a mimicry of the motion what the surgeon performs.
Right, sir. Right. I mean, this is an important myth that we should be very clear, especially for those people who are worried about this laparoscopic surgery, because there are definite advantages for
Robotic,
laparoscopic
not
surgery.
laparoscope.
Robotic, sorry, yeah,
Yeah,
robotic surgery,
yeah.
especially when it comes to recovery, as well as what you call the incisions that they may have on the body, etc. So, Dr. Naik, this is again another question, Dr. Naik. So, what is the ideal cost of this robotic surgery versus an open wound surgery or open table surgery, Dr. Naik? Is robotic surgery like what people think is expensive?
Yes, because technology does cost.
Okay,
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 so the technology related cost is always added, and somebody has to pay for it. So that is how it works. So generally, yes, it is costlier, and the additional cost of robotic surgery will vary from place to place. Really, it's very
okay,
difficult for anybody to comment on that.
okay,
Um,
okay.
but having said that, India and Asia works at a much lower cost settings than Western world. So generally, the costs are much cheaper in India.
Okay.
So that's what I can tell. But absolute costs, I don't think it's a right platform to really discuss.
Right, right.
Mm.
Dr. Naik, I think, I mean, we all have discussed about the positives of robotic surgery, and we all understood how robotic surgery is going to help the recovery of the patients as well as the ease of ensuring that the treatment is done and everything else. Now, let's understand the other side of the coin also, Dr. Naik, because this is a common question because not every day is a Sunday. So, robotic cancer, what are the risks that we can expect for a cancer surgery which is done using robotic techniques?
See, risks related to cancer surgeries being performed robotically, if you ask me, there is actually none. You can't relate
Oh,
it to
okay.
the technology. It is
Okay.
always see, the factors do involve. See, generally, when we talk about any disease outcome, there are three factors, cancer outcomes: the patient factor, the treatment factor, and the disease factor.
Okay.
Right? So these are the three contributing factors which really make a difference in the outcome, overall outcome for the patient. So
Mhm.
yes, treatment where the treatment robo and the way the surgery is performed, what is done for the patient is a treatment factor.
Mhm.
Now, yes, there can be errors or the incompleteness in surgical work. All those things can contribute to the outcome, but it is not that alone. As there are multiple treatment factors, so there are issues which can really contribute to the outcome of the cancer. Now,
Okay.
so it is all about how the surgeon chooses and which type of surgery to be done, and the quality of surgery which is done, which can really give a good outcome. Because in most of the cancers, surgery is the main treatment. It is the main
Okay.
treatment. As of today, it is the center of the treatment.
Oh,
Everything
okay.
else is peripheral. Everything else is
Okay.
called adjuvant therapy. Means adjuvant
Okay.
is in addition.
In addition. Okay.
Surgery, yeah.
Okay.
In addition to what? In addition to surgery.
In addition to surgery. Yes.
Yeah.
So,
So
Dr.
it's
Naik,
all called adjuvant. I'll come to one
absolutely.
more point here. See, the thing is,
Sure.
you are asking about how to choose about robotic surgery and all that. See, when it comes to me, as I'm I can do comfortably open laparoscopic and robotic surgery, all three formats as of today. How I choose is I look at whether the robo wins in very very narrow spaces. Means
Hmm.
it has a very stable 3D camera, very wrist movement where a straight instrument I cannot use. I need to bend the instrument. So I use robotic technology in spaces which are extremely narrow.
Okay.
Like for example, rectal cancers in the lowermost part of the rectum. Rectum means the anus, very close
Yes.
to anus cancers, where you have to save the anus. You have to avoid a permanent bag. There the space is very very narrow. It is you are working in a 1 centimeter space with creating that space and making that area. So those spaces, neck, robotic thyroid surgery, robotic the neck dissection, where we have to do remove the lymph nodes in the neck, inside the chest, where because the chest is a rigid cavity, we don't have too much space, unlike abdomen. So many
Right.
chest surgeries are much easier performed robotically. So
Robotic techniques.
yeah, so I choose robo for very narrow spaces. But
Okay.
there would be surgeons who don't know how to do laparoscopy.
Okay. Okay.
So for them, and if they know how to do robo, all the cases in the abdomen, chest, and everything, they would prefer to take robotically.
Right. Right.
Because to give the advantage of robo or minimal access to the patient, where all
Right.
those lists which I told you,
Yes.
there is definitely a role. So for me, anything in the upper abdomen and many other surgeries which are abdominal cavity surgeries and all, I don't prefer to do robotically. I put them on laparoscopy because it
Okay.
saves the cost, and it same quality of work can be done laparoscopically. So that is how the
Great.
decision process goes. That is my decision process. That is not applicable to another doctor.
Of course,
Okay.
doctor,
Yeah.
because everyone's perception varies, and there are a lot of other conditions that you just mentioned, especially the
Correct.
patient's
Yeah.
condition, the type of cancer, the kind of treatment that has been going, and all plays a very important role. So,
Yeah.
Dr. Naik, as we are talking about these advanced techniques of surgeries like robotic and laparoscopic, are there any ongoing research efforts or clinical trials that are being explored for the effectiveness of robotic surgery for any specific type of cancer?
Yeah, see, ongoing trials, clinical trials are always there. Means, we always study our data. See, clinical trial, when we say generally, means, we are comparing with one with the other, right? So
Right.
it's not necessary. So there are a lot of research which need not be a trial. It can be an observation. Like, if I do say 150 or 200 surgeries on thyroid, I have completed more than 200 surgeries on thyroidectomies we have done for your
Okay.
thyroid cancer and non-cancers and everything, in my
Wonderful.
own technique, rabbit. Now that we are publishing or
Right.
analyzing the data, so that
Okay.
is also
Okay.
research. So
Absolutely,
we
sir.
see,
Absolutely.
yeah, how does it work? How is it safe enough to do? Means what is the safety record over the time?
Right.
See, everything evolves, right? So everything evolves. See,
Yes.
safety of robotic surgery in thyroid has been proven because there is
Okay.
enough effort, enough evidence. But we have to keep analyzing our data at time to time to see if anything new is emerging in the data.
Yes, sir.
So that is always research, because what you saw at 100 may not be same when you see you have done 1,000.
Yes. Yes.
So the
Yes.
things will change, the data will change, the pattern will
We'll keep
change. So
changing
that's what.
exactly based on the sampling and based
Yeah,
on everything. So we agree, Dr. Naik. Dr.
yeah.
Naik, this is again another question which one of our patients have asked us. See, if compared to open womb surgery, if we get a robotic surgery done, can we still continue to take these chemotherapies and radiation therapies, or that's not necessary, or probably that's not recommended? Is the treatment modality going to change based on the type of surgery that is performed, which is robotic or laparoscopic or open wound?
I think in a way I've answered that question before also. See, the three are uh, approaches. Open,
Okay.
laparoscopic, and robotic are three approaches. So imagine yourself that you are going from Bangalore to Delhi or Bangalore to New York for some work, right? So you are going, you have various methods to reach there. You may go by a ship and travel across the Atlantic and reach New York, but the work that you are going to do in New York is not going to change. So
Right.
you're basically, you're decided, see, the what has to be done for you, the surgery that has to be done for you is the journey
Mm-hmm.
between the two spots, point A to point B. Now you have approach X, Y, Z for traveling between the two places. That's all it is. So if you can choose between X, Y, and Z, you choose one of these three based on the conveniences, advantages, disadvantages, based on
Yes.
whether it is offered to you or not. So once you
Yes.
reach the spot B, you do your next target has to be done. So that
Yes.
target, so this is only applied to your point journey between point A to point B. It is
Point B.
not, yeah, related to your point B to C journey.
Right. Right, Doctor
So
Naik.
it
I
may
think.
help you seen something. For example, if you're traveling from point A to point B by train, say from Delhi, Bangalore to Delhi, you're going by train, you may take 3 days. I don't know as of now how many days it takes. But
Yeah.
by flight, you will reach in 2 hours.
Two
So
hours. Yeah.
that's the difference. So
Yeah.
it is quicker, recovery is faster. You go through. So those advantages.
Exactly. So, ladies and gentlemen, I think this is an important point you need to remember when you want to opt for an open wound surgery or robotic surgery or a laparoscopic surgery. The journey is the same. You would eventually reach to the destination that where you want to go to. However, the time that you recover, the exhaustion that you go through in terms of completing that surgery and the recovery plays an important role for your after recovery effects also. However, the time factor of the recovery may change, but the quality of the work will not change unless and until that surgeon who is performing the technique is qualified enough and is confident enough to perform that surgery. Dr. Naik, sir, it has been wonderful discussing this very advanced robotic surgery techniques that we have available in the market, especially for the cancer treatment. I'm sure the patients who are undergoing cancer treatments, medications, and the families that have been being a part of this cancer journey also takes advantage of this laparoscopic as well as robotic surgery for your fellow beings as well as for your sisters, brothers, mothers, fathers, grandparents, etc., and ensure that you give them the maximum recovery quick recovery time and a maximum rest time. We have doctors like Dr. Sandeep Naik available on our platform as well as in Bangalore. There are other doctors that are available around the world as well as in India as well who are thorough in terms of this laparoscopic as well as robotic surgery. Dr. Naik, sir, it has been wonderful talking to you again. We will again contact you, sir, with another important topic after discussing and after taking inputs from our patients and from our followers, Dr. Naik, sir. It has been again pleasure is all ours for taking the time out of your busy schedule. We know patients are waiting for you, sir. Thank you and namaste, sir.
Thank you. Thank you very much for having me.
Thank you, sir.